I'm going to talk about our three most popular Medicare supplement plans. These three plans are Plan F, Plan G, and Plan N. I'm often asked, which Medicare supplement plan is best for me? And my answer is, I don't know yet. We need to talk about your needs, budget, location, and age. This is one of the things that sets us apart from calling the insurance companies directly. When you call an insurance company directly, they can only talk to you about the plans and prices they offer. For example, if you call a company directly to ask about Plan G and Plan N pricing, they can only tell you their prices. When you call me, you're able to get the prices from many different companies and all the plans they offer with one simple phone call. Hi, I'm Chris Duncan, independent insurance broker specializing in Medicare. If you're new to the channel or haven't done so already, please subscribe to our channel and hit the bell for notifications. That way you can stay up to date for new Medicare information and other informative videos. To check Medicare supplement rates, go to our special site for this at MedicareRateQuote.com. You can also call us at 800-910-3382 with any questions, or you can visit our main website at TrustedBenefitsDirect.com. Before we get into the specifics, I need to note all costs I'm talking about here are associated with 2020. We need to remember that original Medicare is Medicare Part A and Medicare Part B. Part A, in general, it covers inpatient care in the hospital, skilled nursing facility care, nursing home care, and this is inpatient care in a skilled nursing facility that's not custodial or long-term care. Hospice care, home health care as well. In general, Part B coverage includes, but it certainly isn't limited to, doctor services, preventive care like cancer screenings, laboratory tests like getting our blood drawn, x-rays, MRIs, CAT scans, physical therapy, occupational therapy, speech therapy, also durable medical equipment like wheelchairs and oxygen, and also ambulance service as well. Medicare will cover 100% of the cost for some annual preventive screenings. A few examples are breast cancer screenings, prostate cancer screenings, lung cancer screenings, annual wellness visits, diabetes screenings and monitoring, and others. Again, this is a partial list. Now we know what original Medicare covers, let's make a quick list of what it doesn't cover. It includes, but again isn't limited to, long-term care, also called custodial care, most dental care, eye exams related to prescribing glasses, dentures, cosmetic surgery, acupuncture, hearing exams and hearing aids, also for fitting the hearing aids, and routine foot care. For our best plan to cover dental, vision, and hearing, please visit our site at seniordentalbenefits.com. Now the hard part is done. Next, we'll get into the specifics of exactly what Plan F, Plan G, and Plan N pays and doesn't pay, and this will go very quickly. The easiest way to compare the three plans is to first look at where all three plans are exactly the same. What these three plans cover is very similar. You'll see Plan F covers the most, then Plan G, then Plan N. And the premiums for Plan F are generally the most expensive, and Plan N is the least expensive of the three. But it is not uncommon for one company to charge more, for example, their Plan N, than another company charges for their Plan G. It is extremely important to compare all companies, all plans, and the pricing. I'd like to add, if you started Medicare after January 1st, 2020, you are not eligible to purchase Plan F. And that is okay because it really isn't a cost-effective plan in almost every case. First place to start is the Part A hospital inpatient deductible of $1,408. Very simply, all three plans will cover this $1,408 deductible at 100%. This deductible is good for the first 60 days in the hospital, and this is called a benefit period. Next is the Part A coinsurance for stays lasting longer than 60 days. Plan F, G, and N will cover 100% of the coinsurance Medicare doesn't pay for. That is $352 per day for days 61 to 90. They will also pay the $704 of coinsurance for stays lasting over 90 days and also the 60 additional lifetime reserve days. After you've used all of the 60 lifetime reserve hospital days, Medicare will no longer cover you. However, Plan F, G, and N will provide you an additional 365 days of hospital coverage. Next, the Medicare Part B coinsurance. This is 20%. I want to note that it actually makes more sense to talk about the Part B deductible first because you have to pay the deductible before the coinsurance kicked in. But because Plan G and N don't cover the Part B deductible, I've chosen to save that for just a little bit later. The 20% Part B coinsurance is covered by all three plans, Plan F, G, and N. But there is a small difference between Plan N and Plan G and F. Plan F and G will cover the Part B coinsurance at 100%. However, you'll notice some asterisks under Plan N in my chart. Plan N will cover all the 20% coinsurance except when you have certain doctor office visits or an emergency room visit that doesn't result in an inpatient hospital stay. When you have Plan N, you will need to make a copayment for these visits. The doctor office copayment is up to $20 and an ER visit is up to $50. Notice I said up to. Sometimes the copayment can be less, but it can never exceed the $20 or the $50. I know these differ a little, but I decided to put them in this section. Remember, original Medicare doesn't cover the first 3 pints of blood under Part A and B. Plans F, G, and N, they will cover the costs for the first 3 pints of blood. If the blood you receive is covered under Part A will cover 100% after the first 3 pints of blood. But if the blood you need is covered under Part B, the $198 deductible must be paid first after the first 3 pints of blood. Then you are responsible for 20% of the blood costs under Part B. But if you have a Medicare Supplement Plan F, G, or N, they're going to cover that 20%. Quickly to recap, plans F, G, and N will pay for the first 3 pints of blood. Part A will cover the Part A covered blood at 100%, and plans F, G, and N will cover 100% of the Part B coinsurance for blood after the first 3 pints. All 3 plans will cover the Part A hospice care coinsurance or copayment if applicable. Also, all 3 plans will cover 80% of foreign travel emergencies after the $250 deductible, and all plans have a lifetime aggregate maximum of $50,000 of coverage. The last section we will talk about where plans F, G, and N have the same coverage is skilled nursing facility stays. Part A will cover all Part A claims for the first 20 days, but if your stay is over 20 days, there is a $176 per day coinsurance you are responsible for days 21 through 100. Plans F, G, and N will pay this $176 per day coinsurance. There is a maximum coverage of 100 days per benefit period, and neither Medicare nor your Medicare supplement will pay any cost for stays lasting more than 100 days. If you use all 100 days and don't have a Medicare supplement that covers the skilled nursing facility care, your coinsurance you are going to be responsible is $14,080. Okay, let's move on to where the plans differ. I mentioned I would be getting back to the Part B deductible. The Part B deductible must be met before the 20% coinsurance will start. And the Part B deductible in 2020, if you remember, is $198. The only plans that cover the Part B deductible are plans F and C. So that means that plan G and N, they do not cover the Part B deductible. The last place the plans differ are what is called excess charges. Plan F and G will pay excess charges, but Plan N will not pay any excess charges. I mentioned before I have a video on excess charges. You should watch it if you want more information. But quickly, some providers can charge up to an additional 15% to a Medicare beneficiary beyond what Medicare pays them. It is very unusual for a provider to charge this, but they are out there. Medicare has a site where you can check this. To learn more, again, I have made a video on how to check Medicare providers that have an excess charge. That's all I have for this video. I'd like to quickly recap. Plans F, G, and N are the same for the Part A deductible, Part A coinsurance. Part B 20% coinsurance except for Plan N and the doctor office visit and emergency room copays. Plans F, G, and N are also the same for blood, Part A hospice coinsurance and copay, skilled nursing facility coverage, and foreign travel emergency coverage. Where they differ is Plan F will pay the Part B deductible, Plan G and N will not pay the Part B deductible, Plan F and G will pay excess charges, and Plan N will not. I hope you found this video helpful. Again, I'm Chris Duncan, and I run an independent Medicare agency. We don't work for the insurance companies, we work for you, and all of our services are free. Because we are independent, we get to represent many different companies to make sure you make the exact right decision for your needs. We help with Medicare Supplement, Medicare Advantage, Part D, final expense life insurance, and protecting retirees' retirement, and much more. It is easy to contact us. You can do so toll-free at 800-910-3382. Get a free Medicare supplement quote at MedicareRateQuote.com. You can fill out our contact form on our main website, TrustedBenefitsDirect.com. Please subscribe to our channel and make a comment. I'm always curious to learn what you're thinking about this subject, or share it to your social media like Facebook and Twitter. We're always putting out information and important news and updates to help with things like Medicare Basics, Medicare Made Clear, Medicare Explained, Medicare 101, and much more. Thanks again, and I'll be looking for you next time.